Hey Bloomfield, it's your mayor, Suzette DeBeatham-Brown. And it's October, it's Breast Cancer Awareness Month. And I am here with the fabulous Dr. Camelia Lawrence. Dr. Lawrence is a breast surgeon with the Hartford Healthcare Cancer Institute. She's a member of the Hospital of Central Connecticut's breast cancer team. Dr. Lawrence has more than 13 years of experience in breast surgery, including reconstructive and plastic surgeries. Before joining the Hartford Healthcare Cancer Institute, she practiced at St. Vincent's Medical Center in Bridgeport. She has been recognized numerous times for her work in the field of breast cancer, including being 2017 Women Leading the Way honoree from the American Cancer Society, a 2017 Doctor of Distinction by the Fairfield County Business Journal, a Lynn Sage Breast Cancer Achievement Award recipient, a Susan G. Komen More Than Pink honoree, and received the Dr. Kenneth Woodward Memorial Award in recognition for improving the health status of underserved patients. That's her background. She is an amazing woman and a champion for women's health, especially in the area of breast cancer. She's a wife, she's a mother, she's just an all-around awesome woman, and I'm so excited that she's joining us today. Dr. Lawrence, welcome.
Thank you, Mayor, for having me. It's my distinct pleasure to be here and to talk about a topic that's very near and dear to my heart.
Thank you so much. So it's October, it's Breast Cancer Awareness Month, and just give us some facts about breast cancer. How do we start to treat our bodies right, listen to our bodies, because they do say early detection is the best for women going through.
Early detection is the cornerstone. Until we find a cure for this disease, early detection remains the cornerstone of in terms of being our best ammunition for breast cancer treatment. So breast cancer is a very common malignancy. In the United States alone, almost 275,000 women are diagnosed annually. However, breast cancer when caught early is very manageable. And what I usually emphasize to women who I meet, whether it's through my practice or out in a community, is that while self-breast exam is not recommended in the sense that there's no evidence-based data to show that it improves overall survival, I personally think that a woman who examines her breast is going to know the landscape of her breast the best. So I strongly recommend monthly self-breast exam. But what are some of the common signs to look for? You're looking for changes within the breast, any lumps that are within the breast, if you've experienced any nipple discharge of any color that warrants a clinical workup. Nipple retraction, change in color such as redness or skin dimpling. Those are some of the common presentation of breast cancer. However, breast cancer can present as just microcalcifications. Those are small little specks of calcium within the breast. And you're not going to appreciate that on a self-breast exam, or will a clinician appreciate that on a clinical breast exam? And that's where screening mammography comes in. That's why it's so important to get your mammogram done, because those microcalcifications will show up on your mammogram and can then trigger a cascade of additional workup that's needed that would allow your cancer to be detected early.
So you talked about the mammogram. At what age should you start your mammogram?
For the average risk woman, the recommended age to initiate screening mammography is age 40. However, if you have a strong family history of breast cancer, that age may even be sooner. So I often say it's very important for a woman, if you have any family history, whether it's on your mom's side or your dad's side, it's important for you to have a risk assessment done. Because while the majority of breast cancer that we see, we don't know what caused it. It falls under the umbrella of sporadic breast cancer. There's about 10% of breast cancer that's due to hereditary factors. These are genetic mutations. It's found within family members. And if you are known to have one of those mutations, for example, the BRCA1 or 2 mutation, the current recommendations for screening is actually for you to start at age 25. So it's very important to have those discussions with your primary care physician or your GYN to see, am I average risk? Should I start at 40, or do I have an increased risk and I need to start at an earlier age?
So thank you. So breast cancer for me, it's the bad word, right? And I say that because I'm a thriver. I'm not a survivor. I'm a thriver. My mother is a two-time thriver. Her
Mhm.
sister is a thriver. Her mother is a
Mhm.
thriver. I have aunts on my father's side that are thrivers,
Yeah.
right?
Mhm.
So we're predisposed, right? I have two daughters, five nieces,
Mhm.
and three grandnieces, right? So all the women in my family, every time I think about this word, I think about them.
Mhm.
So how do we as women help to encourage, educate, and empower other women about the effects of breast cancer, about the treatment for breast cancer, and about how your everyday environment, we talk about the familial predisposition, but how does your everyday environment all feed into the disease?
Yeah. So there are multiple parts to that question. I would say in your particular case, and in terms of concern for the future generation, my hope is that by now there has been a formal genetic counseling and testing, and there's risk stratification that's underway, because knowledge translated to vision, into vigilance rather. And there are risk reducing procedures that are available that can be performed to prevent a woman from developing breast cancer. As it pertains to the BRCA1 or 2 mutation, this is also associated with an increased risk for ovarian cancer. So that's also an important conversation to have with women. When you talk about environmental exposure and things that we can do as women to inform and empower, I think it's really getting the message out and to sort of destigmatize breast cancer. This is not something that you pick up at the store. It can happen to any one of us. There's nothing to be ashamed of. In fact, I would strongly encourage us to empower each other. We talk about, a friend of mine, we talk about a buddy system where once a year we all call each other. It's sort of like having an accountability partner. Have you had your mammogram done? Can we set up a date and time for us to get it done the same day? And we can go get our nails done after, we can have coffee after, or brunch. But just to make sure the test is completed, because as I mentioned before, early detection is key. Breast cancer is no longer a death sentence. It's one of those cancers where we've made so many advances in terms of diagnosis and treatment that women are going on to live very normal lives. In the US alone, we have over 3 million breast cancer survivors. And that's a testament to the treatment options that are available to treat breast cancer, especially when caught early. From an environmental standpoint, we don't exactly know what in the environment that could potentially increase the woman's risk of breast cancer, other than if you've had radiation for another particular malignancy. But I also emphasize to my patients things such as tobacco use, or cigarette smoking. We know that it increases your risk for all cancers, not just breast cancer. I talk about the importance of monitoring your weight. Obesity, we know, increase your risk of all malignancies and other comorbidities, diabetes, hypertension, cardiovascular disease. So I always encourage our patients to maintain a healthy BMI, incorporate exercise into your daily activity. Maintain a balanced diet, a balanced, nutritious diet, a healthy diet. So those are some of the basic conversations that I have with women in terms of things that they can do to help reduce their risk for breast cancer.
So we've come a long way, right? From I call it the old mammograms,
Yeah,
where we have the pancakes,
yeah.
to new technology. Can we talk about some of that? Because I believe it's the new technology that's helping to diagnose earlier.
Yeah, I think what you're referring to is traditionally we have the 2D mammography, and now we have the 3D tomosynthesis mammography. Both modalities still involves compression of the breast. In fact, my patients and I often joke that I bet a man designed that machine because there is compression involved, which can sometimes be uncomfortable. But when you weigh the benefits of having your mammogram done versus not having it done, it far outweighs having mammography. So traditional to say you sort of, top to bottom on one image, compressed image. With 3D tomosynthesis, it gives you an opportunity to have a more in-depth look at the breast. So one of my radiology colleague actually describes it as sort of walking through the forest. So you can see more of what is going on. So you can scroll through it. So you get multiple different images that you can just sequentially scroll through the breast. And what we found in some cases that you can identify cancer at a smaller size and hopefully at an earlier stage. So that's the advantage of the 3D. It is particularly helpful in women who have dense breasts. That's a term that comes up quite a bit because it helps you to navigate through the breast tissue.
I was going to ask about that because I've been told that I have. So, so yeah. The new 3D thing is very helpful for me. So I know that there's different type of breast cancer. I was always told that breast cancer doesn't hurt. Mm-hmm. That's not true.
Yeah, not in all cases. In most cases, it's a painless mass that's identified. I've had patients who come in and say it has been found because they felt some pain or discomfort in the breast that led to a workup that identified that there was an underlying malignancy. It's not unusual for you to have a breast cancer that is infected. In fact, that's one of the things that we are cautioned as clinicians to make sure if a woman comes in with an infectious mass is that we treat with antibiotics for at least 2 weeks, but we do reassess to make sure that we are not missing an underlying malignancy.
I'm trying to think now. October is the month that we make the emphasis, but for some women, or for me, I find that your birthday, you won't forget your birthday. So that might be a good day while you're doing that self-care thing to make sure that your mammogram is a part of your self-care. Mm-hmm. I do know for some people like myself, they also do an MRI. So you could be on that cycle that you do the mammogram, then you also do the MRI so they can get better pictures.
So let's talk a little bit about the MRI because MRI is not recommended as a standard screening test for all women. However, if you are at an increased risk of breast cancer, as you are, Mayor, it will be recommended that you're followed with screening breast MRI in addition to mammography, not as a replacement. So the American Cancer Society recommends MRI as a screening modality for women who have a greater than 20% risk of breast cancer. And typically what we do in a high risk program tests are performed annually, but we stagger them Q6 months apart. So you're not going a whole year without any imaging, yet they're staggered Q6 months, so each test is being performed annually only. And the MRI has pros and cons. However, it's a very sensitive modality of looking at the breast. In fact, those who are against utilization of breast MRI would tell you is because it's so sensitive, it picks up on just about every changes within the breast and can lead to multiple breast biopsy. But in high-risk women, those are greater than 20%, it is the recommendation that they are followed with breast MRI in addition to mammography.
So tell me a little bit about the cancer center there at Hartford Hospital.
Oh, it's a beautiful space. It's state-of-the-art. It's well-designed. It's built with the patient in mind. It's really a one-stop experience for any woman, whether you're coming in for a routine screen mammogram, meaning you don't have any breast abnormality, you're just there for your annual surveillance. And should an abnormality be found, there are clinicians like myself and others, such as my partner, Dr. Duckworth, who are on site at the Plainville location that are available to see you same day for a consultation. And in most cases, we're able to accommodate same day biopsies should you have a positive result. And we have a relationship with her stellar pathology department that gives us a turnaround time of about 24 to 48 hours. So what we're doing is really taking the weight out of the game because there's a lot of anxiety that comes along with a woman being told you have an abnormality within the breast. all the different service line for breast, because the management of the breast patient is in fact a multidisciplinary approach. You may start out with a surgeon, but there's an entire team of experts that are responsible for the care of that patient. And we typically meet once a week to discuss all our newly diagnosed breast cancer patients, because we know that no two patients are exactly the same. And what we do is that we discuss, review the imaging, review the pathology report, and we devise a treatment algorithm that's best suited for that patient. And all the specialists are in that building at the Plainville site, the medical oncologist, the radiologist, the radiation oncologists. We have a lot of support services in place that are all housed within the breast center space.
Excellent. I'm a St. Francis girl, but I would love to come and visit.
Absolutely, Mayor. I would be delighted to give you a tour of the space. It's really a unique experience, and it's a service differentiator in our area.
Excellent. Thank you. Now, breast cancer, are there any symptoms? You know, you don't self-check, you know, most women probably don't. Yeah. Are there any symptoms that, you know, might trigger something?
There's, other than, you know, feeling a lump in the breast, or, you know, having skin changes or visible changes within the breast itself, the other symptoms that I think of, which, you know, such as, you know, bone pain or unexplained weight loss, those are usually signs that are indicative of an advanced stage malignancy. So I would tell patients, you know, or anyone in the community, don't wait for those signs. This is why we want you to come in and get your mammogram done, because ideally what we want to do is find the mass before you can feel it. You know, before you can appreciate it, or before you're having any signs and symptoms of this malignancy. We would like to pick it up on a mammogram imaging or on a breast ultrasound that you may have had performed, you know, perhaps because you have dense breasts. So that's why screening is so important.
Do we all have cancer cells?
We don't all have cancer cells. We all have cells that can become cancer cells. So when you think of cancer cell, you think of normal cells that have lost their regulation. So they're rapidly dividing. And in the case of breast cancer, it happens in the breast, but this is the same process that happens for malignancy anywhere in the body.
And with all the research and the people that you have seen, and what is the most common form of breast cancer?
The most common type of breast cancer is called invasive ductal carcinoma. The second most common is called invasive lobular carcinoma. We know whenever a woman has breast cancer, there are a couple of markers that we look for on their tumor per se. The three common markers are estrogen, progesterone, and HER2. And that's important information because it helps to guide your surgical treatment. It helps to guide the drugs that are available that may be applicable to treating your particular malignancy. It also helps to guide whether you have surgery first versus whether you have your chemotherapy first. So every woman that is diagnosed with breast cancer, those receptors are usually assessed.
And you just touched on it, the different forms of treatment.
So the management of the breast cancer patients, there are three arms. It's surgery, medical oncology, and radiation oncology. And not all patients need all three. For example, if your breast cancer is caught at its earliest stage, stage 0, also called ductal carcinoma in situ, there is no indication for chemotherapy. It's usually treated with surgery, and in most cases, if you have breast conserving surgery, you have radiation after. But those are the three arms that are involved, and it's important. It's crucial that if you are diagnosed with breast cancer and you're recommended to have surgery, you're recommended for chemotherapy, and you're recommended for radiation, that you complete all three arms of the recommended treatment. Partially completing the recommended treatment does not, it significantly impacts your survival. And I've had patients who've had the surgery with me, and I follow up with them a couple of weeks later, a couple months later, have you started your chemotherapy? No, the cancer, no, I think I want to do chemo. Well, while surgery removes the primary tumor itself, the chemotherapy is sort of like a consolidation. You need it, and you do need the radiation therapy, especially to prevent, to further sterilize the area and also to decrease your risk of recurrence. So it's very important that you have the full treatment protocol that is recommended so you can reap the benefit from the full treatment recommendation.
And I'm assuming that Hartford Hospital would be that one stop, right?
Yeah.
Where you can get
Yeah.
all the treatment that you need.
Absolutely. So within Hartford Healthcare, we have a team of expert breast surgeons that's located throughout the state. And the treatment that you're offered at one location is replicated throughout all the different locations. And it's state-of-the-art, high-quality breast care. In addition to that, what we have are breast cancer navigators that helps to navigate our patients once they're diagnosed with breast cancer and follows them through the entire care continuum. And our goal is to make sure that no one gets lost to follow up and no one gets left behind, is that they complete the full treatment, and any additional resources that are needed, could be social resources, psychosocial resources. We have the resources available to plug those patients in accordingly so that we can support them on the journey.
Excellent. Now, are there any risk factors that you can identify?
Well, family history is the biggest, I always say family history is king. In terms of other risk factors, women who've had childhood lymphoma, if you've had radiation, what they call mantle cell radiation, that's another risk factor to increase your risk for breast cancer. We talk about women who've never had children, have had a long period of unopposed estrogen, that there may be a slightly increased risk of breast cancer in that population. Smoking, we touched on, those are all risk factors for malignancy. But I think that the big one that we usually harp on is knowing your family history. And in some patients may not know their family history. I've had patients who say, well, I'm adopted, I don't know my family history. In those cases, exceptions are made in terms of offering genetic counseling and testing so that we can see if there's an identifiable mutation. But the big take-home message here, Mayor, is that I hope that every woman will recognize that they are at risk for breast cancer. We are all susceptible. And the other point that take-home message, I think, is that breast cancer is not just a disease of women. Men can get breast cancer. We see about 3,000 cases every year in the United States. It typically presents with a palpable mass, and in many cases of male breast cancer, there's usually a mutation involved, such as a BRCA2 mutation. So if breast cancer is on your father's side, you're still at risk. It's not just a disease of women where, I have patients say, oh, well, my dad never had, my dad's family had breast cancer, not my mom's family. It's the big picture. We need to look at both sides of the family. Because we get half of our DNA from mom, half from dad.
Half from dad, yes. And it's, even breast cancer, like many, many years ago, there was a stigma. People didn't want to talk about the C word, but we've come such a long way. Medicine has just advanced so much. Even now that you're saying that men, it used to be a stigma for them as well. But because medicine has come such a long way, we as individuals need to be able to come along with it because it will save our lives, right?
Oh, yeah. Absolutely. I was very glad. I think it was Beyonce Knowles' father was diagnosed with breast cancer, and he came forward and publicly acknowledged and spoke about his diagnosis. And I think that sent a resounding message throughout our community that men are susceptible to this disease. It's nothing to be ashamed of, and it needs to be identified and treated as early as possible.
So, Dr. Lawrence, please speak to the women of Bloomfield and every other woman that will be watching this interview and give them your plea.
Well, I want to say thank you so much for giving me the opportunity to speak with the Bloomfield community. Breast cancer is a very treatable disease when caught early. And if you're having difficulty obtaining a mammogram, please do reach out. Hartford Healthcare has the personnel, the staff, and the resources. I personally can help to facilitate you having your screening mammogram done, and should an abnormality be found, we can help plug you in to see one of our clinicians that you're evaluated, and you're provided with the treatment that's needed. So the big message here is breast cancer, we're all susceptible. This is nothing to be ashamed of. If you have skipped your mammogram for the last year or 2 years, it's not too late. I know the pandemic in particular has really disrupted our lives as well as our routine. We've seen a lot of women who have not had a chance, or they have postponed their mammogram and just not had a chance to get back on track. October is Breast Cancer Awareness Month, and I cannot think of a better time of year to remind you that the importance of getting back on track and having your screening mammogram done, because this disease is such a manageable disease. It's very treatable among all the cancers that you can think of, that, you know, it's a missed opportunity. Getting your mammogram can really, it can save your life. It can give you a new start if it's caught early and it's managed appropriately. So that's my message for the Bloomfield community. And thank you again, Mayor, for having me this afternoon.
Thank you for taking time out of your busy schedule, because I do know that you are busy. But listen, ladies, your breasts are your best friends, right? Take care of them. It's saving your life. It's saving your friend's life, your family's life. Let's invest. Let's take that time. Let's make sure that getting our mammogram is definitely a part of self-care. Once again, Dr. Lawrence's information will be available. If you need to reach out to her, if you need to reach out to me, we will make sure that you get the services that you need.
Yeah. One more thing I wanted to mention is that if you're a woman and you're newly diagnosed with breast cancer and you'd like a second opinion, don't hesitate to reach out. I think sometimes within our community, there's a reservation of getting a second opinion. Will it offend my surgeon? Is it the right thing or not to do? If there's any doubt at all, it's worthwhile to get a second opinion. Second opinion doesn't mean you're going to leave the first surgeon that you see. It's really a verification and validation that you are getting the exact treatment that is right for you, that's going to improve or maximize your survival. And you may choose to go back to your original doctor, but you're going back with full confidence that you're moving along the right trajectory.
Excellent. There's a team. It takes a village to raise our families. It takes a team of doctors to help us to be healthy, to be able to enjoy our family. So Dr. Lawrence, I thank you once again. I am sure this will not be the last time that we have conversation. And I look forward to the time when you can actually come to Bloomfield and we can have a sister circle where we talk to our women about women's health, along with breast cancer and other things. So once again, thank you so very much for your time today.
Absolutely. Thank you for having me.